Hey, in this video, I'm going to show you how to clearly tell where you are in the 4 stages of knee arthritis. I'm bringing this to you today because this is the widespread staging system that is used throughout all healthcare in order to determine how severe your knee osteoarthritis is. In other words, if you've been to the doctor and they've told you that you have knee arthritis, or you plan on going to the doctor at some point, this is what you can expect to hear from the doctor. They'll give you a stage most often to tell you how severe your specific knee arthritis is. They use these stages to judge the severity and then determine what treatment you should be getting based on your current situation. I'm going to tell you why the staging system is good and why it's bad towards the end of the video as well. There are some major flaws with this system because we just don't know fully, we don't fully understand as a healthcare profession how knee osteoarthritis progresses and how to manage it properly without surgery. So be sure to watch to the end of the video to catch all those flaws. All right, I'm going to get my very artistic drawing right here. I apologize for it looks like one of my kids drew this, but it was actually me. So there's 4 stages, but it starts with stage 0, so technically there's 5 stages. It's 0 through 4. We'll catch the end here in a second. Just going to get a little bit closer to help me explain here. Stage 0. So in stage 0, that's a healthy knee. That's what we would call pre-arthritic, or you don't have any arthritis, you feel good. This is probably where you are if you're in your younger years. And if you don't have any issues, you have a happy face with your knees. If somebody asks you how your knees feel, you would respond, I feel fantastic. I don't have any problems. I can do whatever I want, and I feel fantastic. You may have had injuries in your younger years, but nothing that would show up on an x-ray, because that's how you determine arthritis is the x-ray. That's like the number one thing that orthopedists or surgeons use to classify your arthritis problem. They'll put that together with how you feel, your symptoms, and your subjective feeling like pain and stiffness and that kind of thing. You'll also have full motion. In stage 0, you have no limitations in motion whatsoever. You feel great. So now in stage 1, in the green right here, you begin to have some irritation. I drew one little tiny red dot. You can barely see it right next to the kneecap. That circle is the kneecap. So thigh bone, kneecap, and then your shin bone is right here. At this point, most people don't feel much pain. They might have a tiny bit of pain, maybe a tiny bit of stiffness, and it barely lasts anything. They usually aren't visiting the doctor at this point, and you'd have to get an MRI or an x-ray to detect this amount of problem inside the joints. Most people just rest and it feels better. It is not really limiting in any way. If for some reason you did go to the doctor, like you had some other problem, like a meniscus tear, or a ligament problem like an ACL tear, and they took x-rays of your knee, they might tell you that there's a little bit of a decreased space in the joint, meaning the space between the thigh bone here and the shin bone, and they might tell you that you have some small wear and tear or degenerative changes in the cartilage. But it's rarely seen. In reality, we don't see many people in stage 1 visiting the doctor unless it's for some other knee problem because it's so minor at this point. If you're in stage 1, what you'll feel is some stiffness when you first get up out of bed in the morning. That goes away within steps. I mean, literally like 3, 4, 5 steps, and you don't really deal with it anymore. Or if you've been sitting for a long time and then you go to get up, you might feel some stiffness for those first few steps after getting up, and then you're fine. The classic that I see is people have been sitting for a little bit, like 30 minutes, an hour or more, and they kind of cool off. They're not warmed up in their body anymore. And then they go to get up and they just are slow to get going. And then they'll blame it on age. Typically they'll say, don't get old, it's hard getting old, or you don't want to be old, these old knees. And you just have some stiffness, and then you kind of shake it off after the first few steps. And then another sign that happens is if people are sitting for too long with their knees bent, the compression going through the joint begins to cause some pain. So they'll say, I can't tolerate sitting through a whole movie, I can't tolerate sitting on the couch for too long or at a meal too long because I need to stretch out my legs and move them around a little bit because there's irritation inside the joint or inflammation inside the joint. That's the very definition of arthritis. Arth means joint and itis means inflammation. But none of these symptoms are very long lasting. They really just last for moments. And then once you get moving, you are fine again. So stage 1 is minor knee arthritis. Now stage 2 right here is going to be mild knee osteoarthritis. It's in stage 2 where people are more likely to begin to visit their doctor. And when they go visit their doctor, of course, they're going to order an x-ray. That's the first reflexive thing that doctors do. They rely heavily on x-rays, which is good for osteoarthritis. And you can see I drew the lines kind of thick here because what they're going to tell you is that you begin to have a little bit of bone spur formation. That's what this mark is and that mark. It's like some thickening in the bone. And then that you might have a decreased joint space as well. You can see there's more space here and here compared to here. And now just before you start criticizing my drawing, I didn't draw everything like to scale on every single one. This is very much a rough sketch. But I think it gets the point across. You have some thickening in there that shouldn't be there. You might also get thinning in the joint space behind the kneecap and the thigh bone. That's very common. And the symptoms, what you'll feel is just a little more intense from stage 1 or the minor knee arthritis. In the mild, this is minor and this is mild arthritis. In the mild arthritis, you'll have even more stiffness when you first get up in the morning or when you get up from sitting. So instead of it shaking off in a few steps, it might actually take you a few minutes now of being on your feet before you shake it off. But people usually shake it off. They consistently will say, yeah, like the first 5 minutes, 10 minutes at most in the morning, my knee is stiff. I need to loosen it up. I need to maybe do some stretches, and then I feel fine after that. Another thing that begins to happen with this individual, though, with a person that's in stage 2 in mild osteoarthritis, is if they're on their feet for too long, usually the threshold is like an hour or more, they start to notice some swelling in their knee joint. And of course, they say they need to get off their feet, their knees are hurting, and they kind of pay for it the next day. They'll say that their knees stay swollen for a day or two or even longer. It just depends on how badly they overdid it that time that they were on their feet. It could be something simple like they took a trip, they were sightseeing and they were on their feet much longer than they're used to, or spring cleaning happened, decorating for a holiday season, doing a lot of cooking can set it off, beginning a new exercise routine where you're being more aggressive with the time on your feet, or you're doing some impactful activity like you started a new walking program, or maybe you tried jogging again because you had done that in the past but you hadn't done it in a while. Those types of activities that increased intensity and duration. Intensity meaning it's more active than you're used to doing, and then the duration meaning you're on your feet for longer than you have been. Those two are a deadly combination to really flare up an arthritic knee in stage 2 and cause some swelling that carries over for at least a day, if not 2, 3, or 4, or a week or more, depending on how bad it is. Now, if the swelling is very bad, you'll also see a limitation in range of motion. So what that means is the knee can't bend all the way, it can't straighten all the way because of the swelling in the joint. Now, it's my belief that when people are in this stage, that's when it's kind of a slippery slope. It starts to go faster and faster that way, and it's a lot harder to come back the other way. And what I just said right there, come back, that's controversial. A lot of people think that it just goes one way and you can't come back at all, but more on that later when I get to the flaws part of this video, so stay tuned, keep watching. Now, since stage 2 is where you're likely to be if you've just visited the doctor, what they'll recommend to you at this point is going to be things like bracing your knee, exercise and weight loss are very common recommendations as well. They might recommend medications and injections like anti-inflammatory medications. NSAIDs is another name for them. Common ones would be ibuprofen and naproxen. Your doctor might recommend gel injections as well, like hyaluronic acid injections. There's a bunch of different injection types, and we've got videos about that kind of stuff. I won't go into the details, but they'll start to do the non-invasive procedures or treatments, meaning not surgery yet. At this point in stage 2, most doctors are going to be telling you that you're not a candidate for surgery yet, that you're not this bad over here where they're recommending a knee replacement. They still want you to do things that do not involve surgery to make sure that you manage your pain here and recover. The problem is people do the wrong things, and I've this whole channel on our section on knee arthritis goes heavily into what to do and what not to do. But make sure to go check out our knee arthritis videos, and this is another plug real quick. We've got a knee arthritis program. It's called the Knee Arthritis Recovery Program that is designed to take you through every single step you need to go through. It's exhaustive, it's comprehensive on what to do to make sure that you can fix your knee arthritis problem and go this way rather than that way. So you can find more about the knee arthritis recovery program down in the description below, or if you just want to check out our YouTube videos about knee arthritis, there's a link for that in the description below too. All right, back to our staging system. So I didn't go over the happy faces. Let me just cover that. So you feel fantastic in stage 0, no problems. In stage 1, you mostly feel happy. There's just moments where you don't feel too good. So the smiley face just got a little smaller. It's a less of a smile. Here in stage 2, you're not that happy anymore because now you have to go to the doctor. This is really interrupting your day. You feel it just about every day. You're limiting your motion potentially, and you can't be on your feet too long. You might even be having pain at night when you're sleeping. It's waking you up. So you're not a happy camper anymore. However, it's still not limiting you as much as it can in worse stages. So it does get worse, but right now you're grumpy. If this condition lasts, the problems that come in stage 2 last long enough, then you move into stage 3. And the specific conditions that I pay attention to as an expert physical therapist are that swelling. If you chronically overdo it somehow, like you're on your feet too long and you're pushing through it, you're forcing your way through things, which you might be doing on your own unknowingly, like you're trying to walk, for instance, to exercise, but it's irritating your knees. Or maybe you're being told to do things that are irritating you, like maybe your doctor gave you a list of exercises to do, or you're going to physical therapy or some other treatment specialist that you hope is going to help you, but their treatment is actually making you worse. It's making you become more irritated, more stiff, more swollen. Then you've got to stop that. The first thing to do is talk with your healthcare provider about it. Make sure they're aware, because maybe they're not aware that what they're doing is hurting you, and you need to tell them. Very much it's just a communication problem very much of the times. But if you've tried that and it's just not working out, or your gut's just telling you you need to go see someone else, then go see someone else about your knee arthritis problem, because you should not be chronically swollen. You should not be chronically irritated. You should be able to reduce the irritation so that you're not progressing into worse stages of knee arthritis. All right, let's talk about stage 3. If you're in stage 3, you're certain that you have arthritis at this point. There's no question. Usually in earlier stages, people are kind of thinking that they might have arthritis. They're like, well, it could be a meniscus problem. It could be maybe a ligament problem, or I don't know, my knee just sometimes hurts, and it sometimes flares up if I do too much. But by this point, they've had enough chronic swelling from phase 2 that they've progressed into phase 3, where there's a lot more active irritation going on. That's why the red here. And you can see the joint space there is severely decreased compared to this one. There's still a little bit more, but of course this one's even better. This is a lot more like the normal side over here. So the joint space is tremendously decreased, and it's usually just one side of the joint. That's why I drew it that way, because it's the inner part of the knee that tends to get compressed first. Not always, that's just what usually happens. I can't give you a percentage of which patients. I'm sure there's a stat out there somebody can dig up, but that's what we commonly see. So in this stage, there's consistent stiffness in the knee. They're dealing with it daily, definitely in the mornings, lots of stiffness in the mornings. They may have more motion in their knee some day than others. Some days they might still feel like they can move all the way, but other days they might feel like their knee just is completely stiff and doesn't want to bend or straighten all the way. They have some motion, but not all the way. The knee is just thicker on that side very often. Muscles start to get a little smaller in the leg usually because they're babying the knee often, so they're just not using that leg as much. In stage 4, it's getting bad. If they haven't gone to the doctor in stage 2, in stage 3, what people are usually doing is they know they should go to the doctor, but they don't, or they're definitely going to the doctor if they're not afraid of going to the doctor. Because, you know, there's people out there that don't want to go see the doctor if you're out there. And you know it's going to be arthritis, and you're probably worried that the doctor is going to tell you that you need a knee replacement. And you know what? It's a legitimate concern, because very often in stage 3 is when doctors start to make recommendations to go talk to an orthopedic surgeon and consider having a knee replacement surgery. But often in stage 3, they're still going to tell you to try injections, medications, all the other treatment options that are out there that are not surgery before going into surgery. Some of the other everyday limitations that people are going to run into this in stage 3 is because they're going to have a more consistent loss of motion. They're going to have a lot of difficulty putting on their socks and shoes, like, being able to reach towards their feet. Stepping in and out of a bathtub becomes difficult because they can't bend their knee enough to step over the wall of the tub. And getting in and out of vehicles is often very difficult because you've got to bend your knee all the way. People with stage 3 or worse, osteoarthritis in their knees, just have to plan their motions a lot more and be a lot more careful. Otherwise, they bend their knee too much and it hurts them and potentially makes it swell more. Other things about stage 3 is simple things flare up the knee, like taking a wrong step, like misstepping, like stepping off a curb and not judging the height of the step very well, like stepping too abruptly, doing just a little too much exercise or just a little too much walking. Using stairs, like people avoid stairs very often when they're dealing with a knee this bad, and if they just absolutely have to, it tends to really bother their knees, and they might even stay flared up the rest of the day going into another day or two. Usually at this point in stage 3, they've been dealing with a knee problem for close to a year now. It has been going on that long. It doesn't always progress at the same rate. Some people stay in stage 1 and 2 for many years. They might stay here for decades even. And never progress into stage 3 or 4. And some people progress really fast. I mean, within a year, they have no problems whatsoever, and boom, they're towards the end of this staging system within a year. Now, let's talk about stage 4. I'm going to come over to the other end here. In stage 4, it's bad. At this point, you're using a walker or a cane to get around. You can't get around without one, without hobbling a lot. It is important for you to take pressure off your leg because your knee joint is so irritated. There's no more space in the joint on either side, on the inside and the outside of the knee joint. The back of the kneecap, there's no space there either, with how it interfaces the thigh bone right here. The cartilage is severely worn out. If you actually get to peek inside the joint, there's blotches of cartilage just gone. And very often there's enormous losses of motion. The knee cannot straighten out all the way, and it cannot bend all the way. And being able to go walking for exercise, people just scoff at it. They're like, huh, forget it. They can't even do it. They feel often like they're at the point of no return. And when they go see the doctor and they're at this point, the doctors very much are telling people, well, you can try all the non-invasive stuff, but you're an excellent candidate for a knee replacement surgery. And I mean, what's the surgeon going to say if they see you walking in and you can, and what you're doing? People in stage 4, what they're doing is they stand up from the waiting room and they're hustling to get over to the doctor's office using a cane or a walker, because they can't stand for more than a few seconds without immense pain in their knee. They lean off that leg, or if it's both knees, they want to sit down immediately. They very often have that walker that has a seat on it so that they always have a place to sit down. An x-ray of the knee joint is going to be obvious for the surgeon. They're going to look at it and say, there's no space in the joint. You have bone spurs all over the place. It's just a lost joint is what they're going to tell you. And you're going to feel like that. You're going to be crying because it hurts and you can't do anything. You can't have a normal life. You can't sleep well. You can't be active. Very often people put on weight because they're not as active, so they can't exercise to manage their weight right. And the exercise, when they do try to exercise to help their weight, they flare up their knees, so they're caught in a vicious cycle of exercising, which is needed for weight management, makes the knee worse, and you can't exercise though because your knee hurts. So you just can't move. It's difficult to move out of this phase. However, we do see people here in my clinic with all phases of knee arthritis, and they do get better. We just have to set proper expectations, because if you're in stage 4 and you have severe knee arthritis, that's what this would be classified as, you're not expected to get back to being like stage 0 over there, right there, or even stage 1 or 2. Maybe you can get to stage 3. Maybe 2, I wouldn't realistically estimate that you'll get there, but maybe that's what you want so that you can avoid having the surgery and get better enough to be able to do what you want to do, to be able to do some simple things in life, like put on your socks and shoes, for instance. All right, so that's the staging system. I'm going to talk about the flaws of the staging system next, because I think that this is a good starting point. In the healthcare industry and in the medical research, This has largely been developed by people that are focused on arthritis, and it's great. It's difficult though to systematize this kind of diagnosis or severity of diagnosis across everybody because everybody's different. But some flaws that I think we need to move away from, and it's going to take a long time. I'm making this video today. You can check the date this video was released, and I'll pretty much guarantee it. The staging system is not going to change for decades. This system is going to be around for 20, 30, maybe 50 years or more. What I'm going to propose to you as a different way of looking at it, I'm probably looked at as controversial here, or as thinking very differently, which I'm okay with. You know what? I treat patients the way that I think here, what I'm sharing with you, and we see some awesome success. And there's a lot of reasons why this staging system is upheld, and a lot of beliefs behind it too. And I won't get into it. Let me just tell you what the flaws are. The first flaw I want to mention is the assumption that you only get worse over time because this is a degenerative condition. It's really important what words are used. The word degenerative puts a certain thinking in people's heads, healthcare professionals included. Degeneration, it means that it just breaks down as time goes on and there's no ability to make it better. And that's what this system is assuming, that you cannot get any better. But we have a growing body of research out there. There's research studies that show that you can have knee arthritis in one of these stages here and do a treatment, a non-surgery treatment like physical therapy, doing the right kinds of exercises, and decrease your irritation and feel better. Now, notice I did not say that your x-ray will look better. If you had an x-ray and it's got this kind of appearance on it, it's got bone spurs and decreased joint space, you go do a treatment to make it feel better, and if you take an x-ray after your treatment, after you're already feeling better, your x-ray might still look like that. And you might still be classified in stage 2 or 3 of knee osteoarthritis. But it's different if you feel fantastic. Who cares what stage you're in? If you're out walking, out exercising, you can bend your knees just fine, and you can tolerate being on your feet for as long as you like. But the general public has a belief, and it's because the healthcare providers as a whole also have the belief, and they're the ones communicating this with their patients, that if you begin to have knee arthritis, that it only progresses. In fact, some people believe out there that it's like a disease, like a sickness that you contract, like a virus or like a bacteria, like how that would spread, like how it spreads through your body and it goes to different areas. But really it's a mechanical problem, meaning there's forces that are accumulating over time, and that's how your joint responds to those mechanical forces. Now, I'm not saying it's purely mechanical. There's definitely dietary influences, hormone influences, and those can show up as like extra blood vessels to the area, and other problems too. There's like hormones that are released, histamine that's released. There's all kinds of chemical processes that happen in osteoarthritis, and there's a lot of medications out there designed to begin to block them and modify all that stuff. But at the heart of it, I think there's still an enormous mechanical component that isn't being properly addressed. And it's just assumed that if you go do exercise, just general exercise, without really paying attention to what kind of exercise you're doing, that it's either going to get better or not. Literally, the recommendation from osteoarthritis experts around the world is to do exercise and lose weight. That's like the most consistent, non-surgical, best treatment that you can do. And I'm not disagreeing with that. All I'm saying is we need to get more specific at what kind of exercise, and not pay too much attention to weight if weight isn't that big of a problem for you. Because there's lots of thin people that are not overweight, or people that have a little bit of extra weight but not enough to really make a huge difference in a knee joint like this. They need to pay attention to what kind of exercise they're doing. Now, because they believe this is a degenerative process and that it just gets worse no matter what you do, that it's just going to happen, you'll often hear doctors say, when you're in these early stages of knee arthritis, if you go visit the doctor, they'll say, in 5 or 10 years, come back and see me, you might need a knee replacement at that point. So they're just subconsciously putting that out there because that's what they believe, And that's what they see. They don't see people go through the right kind of exercise to actually alleviate the problem. So they just assume it's a degenerative condition and it's not going to get any better despite all the weight that you lost or despite all the exercise that you tried out. Now, the second flaw I'm going to point out to you is the belief that you cannot function properly in your joint without cartilage. Now, what I'm saying here is that you can have normal function of the joints. And when I say normal, I'm not saying 100%. I'm just saying you can be functional. Like you can bend your knee okay, and you can do normal things, even if you have losses of cartilage in your joint, like if you're bone on bone, for instance. And the reason why I believe this is because we have a growing amount of research too on this, where there's people that have known rotator cuff tears in their shoulder, meniscus tears in their knee, disc herniations and tears in their discs in their spine, and they have zero pain. Maybe they had pain at one point, but it's healed since then. And even though they have no pain, if you took an x-ray or MRI of whatever body part it is, they still have a tear there. They still have damage that's visible. However, it's stabilized and they're functioning okay. They've done studies like this where they split people into groups of people that have like back pain, for instance, and people that are healthy, they have no back pain, and they do MRIs on everybody, and they find that the MRIs show all kinds of things in their back, and then they can give those MRIs to radiologists, which are doctors that know how to read MRIs, and they tell them categorize these MRIs into who has pain and who doesn't. And what they find is the radiologist can't do it just based off the MRIs. You need to talk to the individual to be able to correlate or put together the MRI and their symptoms, because you might have somebody who feels fantastic but's got bone spurs, torn discs, pinched nerves in their back according to their MRI, but the person would tell you, I didn't even know, I feel great. And then you can have the other end of it too, where people have a perfect looking MRI, but that individual would tell you, I've had back pain that is really bad and I've had it for a long time, and their MRI looks just fine. And you can go from one to another as well. Like you can have a bad MRI, feel fantastic, and then begin to have pain. Or the other end of it, you can have pain in a perfect looking MRI and then feel better, or you can develop signs on your MRI and then even feel better at that point too. What I'm saying here is the MRIs, the x-rays don't always correlate with the individual symptoms, which means that if your x-ray looks like one of these in stage 2, 3, or 4, and your knee hurts right now, it's possible that even though you're bone on bone and you have a loss of cartilage, it's possible that if you do the right things, you can feel better. And what I recommend here on this channel and with my patients that I see in person is a mechanical redistribution of weight. Said simply, we take the pressures off your knee joint using the right kinds of exercises. And over time, that offloads the area that's being extra compressed in the knee joints. If we look at the skeleton, usually it's this inner part of the knee right here where the pressure builds up. And if you take pressure off that area by exercising the muscles in the hip and thigh correctly, then even though you have a loss of cartilage right here on that spot, right here behind the kneecap, you can begin to move more normally, get some freedom of motion back in your knee, stretch it out all the way, and begin to put more pressure through your knee joint and distribute it more evenly, but it requires you having good strength up in the hip. That's a muscle imbalance that I'm talking about, and that's what I talk about addressing all the time. Now, this staging system that I just went over does not account for that. It doesn't account for the fact that you can feel better even though your x-ray looks bad, and it's based on a belief that you just get worse and worse over time no matter what you do. Now, I've organized my systematic approach towards treating arthritis into what I call a phases instead of stages system, and I have similar phases. I don't have a phase 0, but I have phase 1, 2, 3, and 4. And this is available in the knee arthritis recovery program that I mentioned earlier. You print this sheet out as part of the program, and you would figure out what phase you're in. On this side, just to give you a brief overview, in phase 1, this is where we look at it differently. Don't forget the stages that I just talked about. If you're dealing with knee osteoarthritis right now, this is how you would need to look at yourself to get into the right place where you feel better. In phase one, it's severe pain. You have a loss of motion. You can't really do a whole lot. You can't be on your feet. You're having pain at night. In phase two, it's not as bad. You can do a little bit, but it does flare up if you do too much. There's certain exercises to do here, and there's different ones to do here. There's a certain way to approach yourself in phase one, and there's different things to do in phase two. And then in phase three is when you're feeling significantly better. You can actually do quite a bit, but you still do run into some limitations. Your range of motion might come back. It may not, but you can still do quite a bit if your range of motion is manageable, if you can work with it, and which we talk about all those details about how much motion you need to be able to get away without surgery. And then in phase four, this is your prevention and maintenance phase. This is where you are working on the right exercises, like in the gym, for instance, or at home, wherever you decide to exercise, so that you're not progressing into an irritated state again. And that's what stops you from moving into a further stage that way. So I really think that I'm not a scientist, I would say. I think I'm more of an expert clinician, and I don't have any research studies to back this stuff up besides our cases, people giving us good reviews from the program that we have already built, the knee arthritis recovery program. So my expert advice to you, if you're dealing with knee arthritis, is take this with a grain of salt. If you're about to go to the doctor, or you've just recently gone to the doctor, or maybe it's even been a while and you've known that you've had arthritis for years now, this is the staging system that is commonly used. And if you've been told that you just get worse as time goes on, I would raise an eyebrow at that and not fully believe it. And if you've been told that you're bone on bone in your knee and that you need surgery, I would try to exercise correctly to move across these phases in a different direction. This has been a huge help for my patients. This is the treatment approach that I use on my patients, and we've seen them get so much of their life back without having to have surgery, rely on pain medications, or have to get injections every so often to feel better. Hey, thanks for watching. Don't forget to check out those links in the description below for our knee arthritis videos that we have available here on YouTube, as well as you can learn more about our knee arthritis recovery program. There's a link for that down there. I hope to see you in the next video. Bye-bye.